let me share you this secret about the NCLEX exam, right? This should not be a secret, but it's a secret because we pay attention to the wrong thing. We pay attention to programs, question banks, or thinking like nursing students when the NCLEX want us to think like a nurse. Now, one thing you don't know about NCLEX question is that we have uh three structure. Now, take for instance, this is your standalone question. Right, there are three structure. This is structure one, structure two, structure three. This is your body, and this information is for you. This is your stem, and this information is for what? The examiner. This is your answer keys, and this information is to give you what? Extra understanding. Now, if you are not practicing question this way, or if you are not answering your NCLEX question this way, trust me, you are just gambling the exam. You are still answering question like you are in nursing school. This is how the NCLEX want you to answer your question. Now, before you write the NCLEX exam, or you get tested on the NCLEX, now you take your NCLEX exam. There are two things you need to know. You need to know because when I ask a lot of students, I've been coaching for the past 2 years, right? When I ask a lot of students that join my coaching program, do you know the NCLEX content? They say they know about it. They have been learning some on certain program. I'm like, where do you feel those content are coming from? Say content from nursing school. No. Where those NCLEX content are coming from are from what? The NCLEX test plan. Now, if I join a certain program, take for instance, I'm a student like you, right? And I join a certain program, and the content is not matching what is on the NCLEX test plan. That program is not going to help me succeed. That program is not going to help me pass. Instead, that program is going to give me doubt about passing the exam. Now, another area you should be checking on the NCLEX content is from what? The practice analysis. The practice analysis. Now, the NCLEX test plan include your content. The practice analysis include your knowledge statement. Now, content knowledge statement. The knowledge statement is very important, even than the content, because this knowledge statement, the NCLEX use the knowledge statement to create the content. Now, the knowledge statement, they are very straightforward, right? Unlike the content, it's just like a long sentence. You need to figure out what is going on. But the knowledge statement, just maybe 2 word sentence, you already know what is going on. Now, on your NCLEX exam, right? Let me give you your question again. Now, look how your question look like. On the NCLEX exam, the NCLEX will test you on the knowledge statement. Now, the content give you more description of the knowledge statement, but you can still understand the knowledge statement, right? If you know how to practice right or study right. Now, this is your body again. This is your stem, and this is your answer keys. Now, your all those knowledge statements and the content will be on the NCLEX exam. The NCLEX is not hiding what will be on the exam. Unlike nursing school, maybe in nursing school, maybe they might not tell you what will be on the exam, because nursing school is about general knowledge. NCLEX is about concepts. Know that now. NCLEX test concepts. NCLEX don't test general knowledge. NCLEX test concept. NCLEX test 6 concepts throughout your 85 to 150 questions. But nursing school tests you on general knowledge. Right, know that. So NCLEX is not about general knowledge. NCLEX is about the principle that make you a safe nurse. And this is how they test it, using 6 concepts. Right. We are going to talk about the concept later, but let's talk about the question. Now, those knowledge statements. Now, let me tell you, for the NCLEX RN, we have 146 content and then 338 knowledge statements. Now, for the PN, we have 150 content, 280 knowledge statement. Now, once you know this knowledge statement, you are going to pass the NCLEX exam. Not only you are going to pass, you will take the NCLEX exam. The exam is going to be so tired of you that the exam have no choice than to stop in 85 questions and then give you a pass result. Right. I want to give you clarity. Now, pay attention to what I'm saying. This is your question, right? Now, remember I said PN 280 knowledge statement, registered nursing 380 knowledge statement. This is your body. The body is for what? You. This is your stem. This is for the examiner. And then this is your answer keys. Right. This is going to give you what? Extra understanding about what the question is talking about. Now, if you don't answer question like this, then there's a problem. Now, the body of your question includes those knowledge statements. Now, the reason why you don't understand the NCLEX question is that you rush through reading the question because you are more interested in the answer than the question understanding. Now, the NCLEX want to test you as a safe nurse, so they are going to put a certain knowledge statement right here. They might not write it straightforward. It's just like now, maybe the NCLEX want to test you on advanced directive. The NCLEX might not write it as advanced directive. Sometimes the NCLEX can write it as advanced directive. But if you understand advanced directive, or you've seen on the knowledge statement that NCLEX want to test me on advanced directive. Now, when you go on the NCLEX exam and you see advanced directive, even though the NCLEX did not write it directly, or maybe they just write a certain interpretation of advanced directive, from the body of the question, right here, you will be able to understand that, oh, this question is testing me on advanced directive. Now, if you have a good resources that you are using for studying that have broken down advanced directive for you, then you automatically know what the NCLEX will ask you. Now, the next thing is to look at the stem. The first part of your question, which is the body, is not your question. This is just for you. This is like giving you what is going on. Now, the second part of the question is the stem, right? This is for the examiner. This is whereby you get the question. This is where the question gets to be asked. This is not the question. The second part is the question, followed by your answer keys. Now, let me tell you how the NCLEX work. Now, NCLEX tests you based on 8 client needs. And each of these 8 client needs contain the 6 concepts that NCLEX tests. Now, NCLEX want to know if you are a safe nurse. So they test these 6 concepts in each of the 8 client needs. Right. In each of the 8 client needs. That's how the NCLEX work. Now, in order to arrive at the concept that the NCLEX is testing, first of all, you need to know what category, what client need are you answering. Now, you might easily know the client need from the body of the question, you might know from the stem, or you might know from your answer key. That's the reason why your the first thing you do when you are looking at the NCLEX question is not to answer it straightforward. You need to firstly know what client need this question belongs to. You can easily know from the body, the stem, or the answer key. This is what I teach in my program, right? Then you will not be able to know the concept. The concept is not difficult. Let me tell you the concept. The concept is the same for PN and RN. NCLEX tests the concept of what? Caring. Now, if you don't know the concept of caring, you are going to see a lot of caring questions on the NCLEX exam. You will not be able to answer it. Now, the second one is clinical judgment. Now, clinical judgment can be your case study, chart, bow tie, right? Now, the third one is communication and documentation. Now, NCLEX can test you on communication and they can also test you on documentation. They fall under the same concept. Now, 4, the NCLEX will test you on culture and spirituality. Now, according to what I'm listing right here, this is what is on the NCLEX test plan, right? That's how the NCLEX tests the question. So if NCLEX want to test you on clinical judgment, they know you are doing advanced clinical thinking, reasoning. So you need to follow a certain process. If it is bow tie, you need to understand how to answer it. If it is case study, you need to understand how to answer it. If it is chat, you need to understand how to answer it. What is the principle behind communication? And how do you communicate in settings, in various settings? Documentation, what is about documentation? This, if you understand the concept, when you get a particular question, even though the question is written in like say 20 various ways, right, or 20 different questions, in as much that concept is about documentation or that concept is about communication, you are still going to get the same answer. The answers don't change, might be written in a different form, different question, but the same answer the NCLEX wants still remain the same, understanding the concept. Now, the fifth one is nursing process. Now, if you see a particular question and the question is testing your nursing process, you should be able to know and be able to apply what the NCLEX wants you to apply. The last one is teaching and learning. Now, you will find out that most of your questions, if you are you've taken the NCLEX exam before, that most questions you just see the nurse is teaching a client, the nurse is teaching as a nurse taught or learning staff education about. You understand? You've seen all this kind of question, right? You've seen a question that say the nurse is collecting data, the nurse is caring for a patient. This is that. What would you do next? What would you do first? These are nursing process questions. You're seeing question about culture, spirituality, whereby the nurse is talking about certain patient culture, their spiritual life. All what the NCLEX just want you to do is to just include those things into their plan of care without questioning them. Communication will communicate with both staff member and client. What are the principles of communicating with staff member? What are the principles of communicating with other team member? What are the principles of communicating with client? Documentation, straightforward. Anything you do, document it. Everything, document it. That's what the NCLEX just want to do. NCLEX can give you a certain question talking about different thing, but we just put a certain option that have to do with maybe omitting documentation. That would be wrong thing to do because you don't want to omit documentation. NCLEX just want to see whether when you are also planning care for a client, you also know you need to document those care. Documentation, clinical judgment, I mentioned about that. Now, when you look at your question, the first thing you want to pick out of the question is what knowledge statement is the NCLEX testing, right? You want to first know the client need, right? The moment you know the client need, now you already you are now 25% away from answering the question. Now, when you know the knowledge statement, you are 50% of 50% additional to the 25, so that is 75% away from answering the question. Now, all you just now need to now know. Oh, sorry. This is what I meant to say. You are 25% of answering the question. Now, once you know the knowledge statement, the last thing you want to now know is the concept that the NCLEX is testing. The concept is always in the body. The NCLEX can say teaching, it might be communication, but you don't just know how communication question is being written. The NCLEX can say the nurse is discussing with so, or the nurse is about to transfer a patient to so. That's the means of communication question because communication will go on, right? Or the nurse is talking with the patient who have maybe schizophrenia. Patient with schizophrenia is saying so kind of things. That is communication question, right? You will understand it when if you join my program. Yeah, you will definitely understand more. Now, concept will give you the other 25%. That's a total of 75%. Now, this area is 25% that will make it 100% for you to log down the correct answer. Once you can master this, you are going to kill the NCLEX exam. I'm telling you, 85 questions, the NCLEX will be already tired of you, will stop the exam, and you're going to pass. All right, so if you want to learn this concept of answering NCLEX question, a way that you go on the exam, you have clarity, it looks like you are taking another practice test, just text me. Now, +17676130769. Text me. Right, I'm going to help you out in passing the NCLEX exam. Right. My coaching program is for 60 days. Right. You can also say 8 weeks, or you can say 2 months. Right. And all this I'm going to give to you clarity, understanding how to break down the question, coaching, live Zoom session 3 times a day for 1 hour each of those days. I'm just giving it to you for $497. Most students in my program decide to either pay 250 2 times payment plan, or they pay 125 4 times. Right, you can decide how you want to do it. Anything just to join the program and pass in 85 questions. So if you have struggled with the NCLEX exam, now is the moment to pass with clarity. Right, so join my program. Right, this is my phone number on the screen. Right, in order to pass the NCLEX exam. So I'll be waiting for your text message.